Hello, I am Dr. Syed Raza and I work as a cardiologist and physician. By no means I am a quality expert or a quality guru, but in the next 20 minutes or so, I'm just going to give you an overview as to what is quality and safety in healthcare in current era. Well, when I trained as a medical student, there was no curriculum in medical school where we were taught quality or safety in healthcare. And when I was working as a junior doctor, as a resident, we had absolutely no clue as to what patient safety was, what medical quality was. And it is only in the last 3 decades or so and more of in the last 1 decade, in last say 7 to 10 years, we have seen that there is more focus laid on patient safety and medical quality. Now, if I show you this picture on the screen, and I'm sure this is not a rocket science, when I ask you to pick the best apple or the apple which has the best quality, and I'm sure you are all going to pick apple A. We must not forget that the quality that this apple has today, we must look into how this apple was first of all harvested, how it was processed, how it was delivered, and also how it was preserved. Likewise, in healthcare, it matters what is the work that is being done behind the scene to improve the quality in the healthcare or the healthcare system that we provide service to our patients. Now, if you are going to buy a car, and if I ask you what is the most important thing you're going to look for, the most important feature that you will look for when you buy a car, some of you may say you will look for comfortable seats. Some of you would look for even the model or the color. And by the way, this is apart from the price or the cost. Some of you would go for the good navigation system. Some would go for the audio system. Some of you would check the air conditioner, the mileage, and so on. But the most important thing sometimes we tend to overlook is the safety aspects of the car. We sometimes do not look at the safety aspects. So the airbags, anti-lock braking system, sensors that alert you that you are speeding or there's a risk of collision. Likewise, we have got to look at the safety aspects when we provide care to our patients in the healthcare. Toyota, as you all know, it's a big name in car industry, and how it earned its big name is mainly because it worked on quality, providing quality cars. And it was back in 1980s that Toyota became a leader in providing good quality cars. And it worked on the principle called Kaizen principle, which is a Japanese philosophy, and Kaizen is made up of 2 words. Kai means change and Zen means for good. And they worked with the Kaizen principle where they reduced the defects in the cars, eliminated the wastes, they boosted productivity, and they encouraged and empowered their workers. But at the same time, the workers were accountable to what they did. They were free to make innovations and research. But they worked on a basic principle that they cared for the quality, and caring about quality became an essential attitude for them. The approach to quality was always better cars for Toyota. So it is an essence that we must bring about change, and any change which is a positive change, no matter how small that change is going to bring about improvement in the quality. Now, when we are planning to improve quality in healthcare or in any other industry, there are some tools, or rather I should say there are some models following which we can improve the quality. Some of the models are like Six Sigma, there's Lean model, but a very popular model that we also apply in healthcare is PDSA cycle, which is plan, do, study, and act. So once you have a quality improvement project, you have got to plan it. You got to have a definite goal, and these must be SMART goals when you choose to do any activity or project to improve the quality. You must have the adequate manpower. You must have the adequate resources. You must provide the training to the manpower, the people who will be taking part in the quality improvement project. And once you have the plan, then you've got to execute the plan, do the project. And as you go along doing the project, you've got to monitor, you've got to check whether you're going wrong or right, whether you are on the track or not. So you've got to evaluate and you've got to audit as to what are you doing. And once you have that evaluation and monitoring, you've got to reflect back as to what you have checked, what you have monitored. And from there on, you'll decide whether you go ahead with the project, you just hold the project the way it is, or you bring about new changes, or also you may just stop the project altogether. These are some of the principles that are applied in total quality management. But the most important of these is the leadership. And some of these principles, they also apply in the healthcare. And leadership is an important part and parcel of the total quality management. If there is no leadership, if there is no strong leadership, then obviously any project is not going to be successful. A leader on his or her own cannot run a project. It has to have a team. So there must be involvement of the right-minded people who are adequately trained, who have got the right skills, and they know how they can work in a system. And there is a system approach to work as well as management. And then there is a process approach. There must be some process in place which all the team members have got to follow, and these team members will work in a cohesive manner, will support each other. But above all, what you see here is the customer focus, and that I believe is the most important aspect of the principle of total quality management. And in healthcare, who is our customers? It is our patients. So the patients must be at the focus at any given point of time and all the time. If we need to improve the quality, then we must have a strong leader. And the most important aspect of the leader is that the leader must have a good vision. And good vision in healthcare is equally important as it is in other industries. And the leader should work with as to where we need to go. We must have a clear goal where we are going. And then how we are going to get there, how we are going to reach, when we are going to reach, and also we have got to assess ourselves from time to time as to how far we are from our goal. But at the same time, we must also look back. For being successful in life, yes, we have got to move forward, but it is also important that we look back, we reflect from where we started and how we started, and also what are the mistakes that we made on the way and how these mistakes could be corrected so that these mistakes are not made again, and we can learn from those mistakes and get better and better. But the most important thing is that whatever we do, we must do safely. We have got to be safe. Now here are the 6 dimensions of healthcare quality. And on the top you would see this is safety. And without saying, safety is the cornerstone of improving quality in healthcare. We must at all costs avoid any complications or injuries or harm to our patients. for whom we are caring in the healthcare setting. The services that we provide should be provided without any delay, without any delays that will cause patient harm, or at the same time they may cause some discomfort. The care that we provide must be effective, meaning thereby whatever care we give, those must be evidence-based. We must give them the treatment that must work for these patients. We should not give something that does not work. And also that there must not be waste of resources. We should not do unnecessary tests for the patients. We should not use unnecessary medications. We must not make use of costly machines where the output or the result may be negligible or zero. But at the same time, we must remember that whatever care we provide to our patients must be equitable, meaning thereby the care should be provided irrespective of the status of the patient, irrespective of the age, the gender, the racial background, the financial capacity, and the position of the patient. And above all, the care that we provide must be patient-centered. We must take patients as partners, and we must respect their wishes. And at the same time, we must remember that whatever we do it for the patients. As we do any quality project, we must apply a few tools to check as to how we are doing. So we must use these tools to measure as to how good we have done or if there are any areas of improvement. And it has been rightly said by Peter Drucker, who was a business consultant and educator, and he said that if you can't measure it, you can't improve it. So if you can't measure it, you can't improve it. During the last several years, it was observed in the past that lots and lots of medical errors were being made, following which these medical errors led to a lot of complications, and that ultimately also led to a lot of deaths in the healthcare system. And it was many years ago, in the 17th century, Hippocrates already wrote in one of his literature that first do no harm. Yes, first do no harm whenever we are providing care to our patients. In year 1999, the Institute of Medicine released its first document, To Err is Human, and this was after observation that there were thousands of patients who were dying due to medical error. And this was a huge burden on financial resources. And it was estimated that cost of medical errors led to $7 billion to $29 billion lost per year in the United States. And from then it became that reducing preventable medical errors was a movement in healthcare. From the same publication, To Err is to Human, this report concluded that 44,000 to 98,000 deaths occurred every year in the United States, and that made medical error as the 8th leading cause of death. Yes, 8th leading cause of death was recorded in this publication, To Err is to Human. Furthermore, in 2013, there was a new study that was published in the British Medical Journal, and this estimated that medical errors were the cause of more than 250,000 deaths, 250,000 deaths and more. And this made it the third most common cause of death in the United States. So you can imagine that the number from the ranking 8, the medical error was the cause for deaths in the hospital as number 3. So it may mean that we became worse in terms of reducing the mortality due to medical errors, but it also means that people were probably more aware of the medical errors, more medical errors, and the medical errors that caused complications and deaths were being reported. Whenever a medical error is made and it leads to complications, may or may not lead to death of the patient. A finger is always raised at the doctor or nurse or a paramedic. But we all know that they always may not be at fault. There may be fault in the system. There may be fault in the process. There may be conditions that they work in may not be appropriate or may not be such that they can prevent mistakes or fail to prevent mistakes. In 2011, Lam Donaldson in WHO published that going into hospital was far riskier than flying, and he put forward few shocking statistics. Risk of error in healthcare was 1:10, which means if there are 10 patients going to the hospital, one of them was at risk of some kind of medical error. And the risk from dying from medical error was 1 in 300, which means if there are 300 patients admitted in the hospital, one of them would die from some kind of medical error. And this was far, far more than risk of dying from airplane crash, which was 1 in 10 million, which was hardly anything. We all know that the mistakes or the medical errors are the commonest with medication. The way they are prescribed, the way they are dispensed, and the way they are administered. And it is estimated that over 1 million mistakes are made with medication every year in the United States of America. And the second commonest preventable medical error is hospital-borne infection. And 1 out of 25 patients who are admitted to the hospital are at risk of developing hospital-borne infection, or what we call nosocomial infection, which are, by the way, are preventable. We all know what are the measures to adopt to prevent the hospital infection, but despite that, we see that the numbers have not gone down. Here are the 6 international patient safety goals, and I'm not going to go into detail, but I'm just going to allude you as to why they are important. They're important because these are the 6 aspects that increase the chances of medical errors in the healthcare system that leads to complications and mortality or deaths of these patients. Identity of the patient is crucial, and that is the starting point when we encounter a patient in the healthcare system. We must check their identity very well by asking their first name, middle name, last name, as well as checking their identity by their ID number or a passport number or hospital number. There must be effective communication. It is important how we communicate between colleagues or superiors or juniors, doctor to nurse, doctor to doctor, nurse to nurse, and so on. At the same time, we must recognize the high alert medications, the look-alike, the sound-alike medications, the medication that are at risk to produce harm to the patients. We must be careful with these medications. Whenever a patient is going for surgery, we must ensure that it is the right patient going for the surgery, the right surgery is being performed on that patient, and the right site for the surgery has been chosen. Then there are a lot of safety checks for the anesthesia, the consent, and so on that must all be fulfilled. The risk of infection must be reduced, and we all know that hand hygiene is so important. The 5 moments of hand hygiene must be adopted, and we must adhere to all the risk prevention as far as the infection is concerned in the hospital. At the same time, we must reduce the risk of patient harm that happens from falls. This is a concept that has been adopted in safety, which is called PACE, which is nothing but an acronym where P stands for probe, A stands for alert, C stands for challenge, and E stands for emergency. And I'm just going to explain this with a scenario. Suppose a junior or trainee resident surgeon is operating on a gallbladder, and he is being assisted by a very senior consultant anesthetist. Now, once the anesthetist observes that the surgery is not going well and the trainee surgeon is struggling in doing surgery, then he has the right to probe, and he or she may ask if everything is going okay. How is it going? And if he finds that he is having difficulty maintaining the blood pressure of the patient and few of the vital parameters, they are not doing very well for the patient, and he may alert the surgeon that the patient is not doing well or the patient is deteriorating. If things do not improve, then he has got the right to challenge and say that you are really concerned. And beyond that, if he still feels that the things do not improve, then this is an emergency situation. Either he may take over the decision and he may ask the surgeons to stop the surgery, or he may call his senior or senior consultant surgeon and to just give the trainee surgeon a hand. So that is PACE: probe, alert, challenge, and emergency. So until recently, we have seen lots of mistakes have been made in the healthcare for many, many years, and these mistakes have caused complications, and these complications have led to several deaths in the healthcare, unfortunately. But what would happen? All these cases would be brushed under the carpet. Nobody would talk about it. There will always be hush hush. Everything will be hidden. So now if you see that the medical safety of a patient is being compromised, then you do not be just a silent observer. You should not suffer in silence, but rather you have got to learn to speak up for patient safety, because we know that no patient should be harmed in healthcare. So safety is everyone's responsibility. It is just not the responsibility of the quality or safety officer. It's everyone's responsibility, irrespective of your status in the healthcare system, whether you're a doctor or a nurse or a paramedic or a safety officer or even a janitor. Everybody has a responsibility when safety is concerned. So to finish, if you ask me, do quality and safety matter? And I would say yes, of course they matter. When you go to buy a car, we are looking for all the quality aspects that the car may offer. We also look at some of the safety aspects that the car must have. So why not our patients be denied of quality care? So they have equally the right to have the quality service that we can provide them in the healthcare. But at the same time, it is our moral duty to keep our patients safe in our healthcare system. So whenever they come to hospital, they must return safe. They must return to their loved ones in good health. With that, I thank you very much.